G'day mate, 40 here. So I have a friend, he's like very passionately against supplements. He's just totally for evidence-based medicine. And I'm for evidence-based medicine too, but I don't think it's the final word. It's like I enjoy reading evolutionary psychology and works of like atheists and secularists on religion, but I don't take that, secular scientific approach is the last word on matters of religion and matters of the soul. So yeah, generally speaking, evidence-based medicine, that's great. That's the way to go. But I'm just thinking from my own life experience that some like little health issues that I've had, best solution for me is just to go on Amazon.com, put in the issue, and that's how I found my azo cranberry urinary tract health. Man, just like streaming like a son of a gun after taking this, just fantastic. And then at night you want the opposite thing going down. Like at night you want the beta cysterol plant sterols, so you're not getting up all night. So I learned this on the Kaminsky method. And then I was getting these gallbladder attacks mild after eating a meal with fat, and then I got some Dr. Berg gallbladder formula. Problem completely went away. So yeah, I think there are a lot of supplements that are just great. And then there are other supplements that probably only have a placebo effect. And I'm fine with that. Like if a supplement simply gives me the placebo effect, that's cool by me. So I know people who suffer from chronic fatigue syndrome, and they just got on ancestral supplements and started taking beef organ supplements, and it just like completely changed their life. They experienced a whole new, sense of vitality and strength. So I'm sure that absolutely works for some people. Now, just talking here off the top of my head from my life experience, when I had chronic fatigue syndrome, I probably saw about 50 doctors over the course of 6 years when I had it most intensely, and another dozen in the next 10 years after that when I had it less intensely, and only one of them ever did me any good. Right? There was one doctor, Dr. Daniel Goldwyn, the late great psychiatrist in Orlando, Florida, Daniel Goldwyn. I saw him in 1993, and he got me on Nardil, and that restored me to 2/3 of a normal life. So Nardil helped give me my life back. So one doctor made a difference, 60 other doctors, nothing. Remember I had like tennis elbow because I spent much of my life blogging, and so I developed tennis elbow, and I went to Kaiser, and they just recommend, get these bands and just like wrap them around here to take the pressure off your elbow. Like, so the advice I got from Kaiser was no help whatsoever. Now, I had a friend who was a screenwriter says, for that you need to get acupuncture. So I'd never had acupuncture before, but I finally got acupuncture in 2007. About 5 sessions of acupuncture took my elbow pain completely away. So Kaiser was useless. Acupuncture was great. And then after that, I got a recommendation to a great physical therapist, and he was able to take away these sort of problems with just like one session. So where it'd take like 6 or 8 sessions of acupuncture, go to the physical therapist, and he'd take the problem away. A great physical therapist. So great physical therapists don't accept health insurance, don't work on a lean basis, right? So then after that, this great physical therapist told me about the activator tool. I observed him using it. I asked him, do you think I could use one of these, learn how to use? He says, sure, come on in and we'll teach you. Well, I just went out and bought the activator tool, and then bought the textbook that shows how to use it. I haven't been back to a regular physical therapist, even though he's fantastic, since then. So this was something like 2016. So I've been asked to skip about $1,000 a year in physical therapy bills just by the judicious application of my activator. So great physical therapist is wonderful, but for me, pretty much all conventional physical therapy can just be skipped with the proper use of the activator. Now, I've had a fair amount of chiropractic. I've probably had 50 sessions in my life. Generally speaking, I found that the benefit does not last long, but there were times when my back would go out and the chiropractor would pop me back in, and then I was able to go pretty much right back to a normal life. So if I didn't do anything, my back pain, when it was most severe, would ease after about 3 days. But sometimes I'd see a chiropractor, he'd pop me back in, and I was able to go back to normal life. So even chiropractic has its uses. Now, I remember going to Kaiser. I had reduced range of motion, I think, in my right hip, and I remember the doctor like taking my leg, and he just like took it so roughly. It's like, ah, like there was no care, and he said, oh, you just take some Tylenol, and maybe in a few years you'll need a hip replacement. I mean, this was just terrible advice. When I found that great physical therapist, he was able to go right to where the problem was with my hip and unknead the muscles that were tight, and completely took care of the problem. So great physical therapists have been a huge benefit to my life. For years I had moderate right knee pain. I think I was on a date, or about to go on a date, and I ran across Pico Boulevard, like charged across like 6 lanes of traffic, and after that my right knee was a little hinky, and then a great physical therapist told me, oh, let me just unstitch the muscles leading to your knee, and as soon as he did that, knee pain completely went. So physical therapy, judicious use of the activator, occasionally the right supplement. And I can't think of many times when a regular medical doctor made that much of a difference. So about 12 years ago, I had nasal surgery just to remove, like to open up my nasal passages, turbinate reduction surgery. And that was fantastic for 2 months. But then the turbinates just grew back in. So limited benefit there. And once when I was a kid, I think I was like 6-7 years of age, and I had high temperature going on and on and on. And a doctor, back when they made house calls, came, gave my mother a suppository, and completely took care of the problem. So that was one time a regular doctor made a difference. Had a car accident, and so they sutured my wound here. That was nice. But generally speaking, I think we overestimate how much good that regular medicine can do. Like, it's good for peace of mind, and there are some specific applications where it's excellent. And I'm a big believer in vaccines. I get the flu shot every year. I've been vaxxed twice for COVID. But I think there are other situations where more alternative methods are more effective, maybe even more cost effective. So, got an open mind, whatever works.